Before we dive in, I'd love for you to take a moment to rate and review the podcast. Your support helps me to continue to bring these meaningful and hopefully inspiring conversations to help you take action and achieve your dreams. So let's do this. Hello, welcome back to the Jackie Tam podcast. This week, I am so happy to bring you back the extraordinary clinical psychologist, Dr. Alexandra Guhde. So in this episode, we go through all the things that we think could possibly hold you back or you find scary, and when I say you, kind of mean everyone and me, all of the things that are holding us back. So we really wanted to break down all of the things for you to think about so you can make this process as comfortable, as easy, as unscary as possible. So without further ado, let's dive straight into this episode with Dr. Alexandra Guhde. Alex, welcome back to the podcast.
Thank you, Jackie.
Pumped to have you back. When we finished our last one, it's like writing down all the things that I want to talk about next. And I sent those to you, and you're like, maybe we'll just start from the beginning. Like, oh, that's probably a good idea. So today we are talking about the beginning of, or setting the foundations for, getting therapy, how to do that, how to pick the right therapist. So in your mind, what is the best way to start this entire process?
Oh, that is a question. I don't know that there is a best way.
Okay.
I think it's very different for everybody. But I think, first of all, it's such an important decision, and people often go into it really, really uninformed. So very often, you go to your GP and the GP will suggest therapy, or you might go to your GP to get a mental health care plan and they will make you a referral. And if you have a great relationship with your GP and you feel like they know you and that they know the person they're referring to you, chances are it's going to be a good fit. But there are a lot of people who don't have that relationship with their GP. So to just go to the person that the mental health care plan is written out to, you don't have to do that. You're allowed to choose. And you don't even have to go to the person your GP wants you to see, and you can still use your plan.
I think that's the biggest question is like, can I still use the plan if I don't see the person that you think I should see?
Yes. And first of all, I should say, right, I mean, this is a particularly Australian way of entering therapy. In America, your GP, they might recommend a therapist. They might not. They might have nothing at all to do with it. So culturally, it's very different, the beginning. And in America, a lot of it has to do with what insurance panel your therapist is on. So who you see might have to do with who your insurance provider is. And all of those, I think, are not great ways to choose, like, what your doctor recommends, what your insurance says that they'll cover. Like if you think about what you are actually paying for in this expense, there's not a lot that's more important. So also sort of you get in what you put in. So I wouldn't recommend shopping for your psychologist by price. Of course you might have a budget.
Yeah.
Right. And that's important. But the price is secondary. If you find someone that bulk bills and covers the whole cost and that's no gap payment, that's fantastic. And they might be fantastic. There are actually a lot of good bulk billing psychologists. One, either they care a lot and they don't care about money very much, or they're young and just starting out and they're going to be excellent and already are excellent. And then there are a lot of people who that's how they need to make their money because otherwise they can't retain their clients. So I think the most important, if you come back to your question, which is what's the best way, is you need to feel good about your choice. So you need to be drawn to this person for some reason. So if you're, say, reading on the APS website or reading on the PACFA site or the Psychology Today is a website where a lot of therapists post little blurbs or little videos about themselves. Like, if you feel drawn to something, call, email, text, however you get in touch, and see what you get back. Mm-hmm. And because there's a shortage of psychologists in this country, you might have to call around a lot. And then see how you feel. You have to keep checking in on how you feel with somebody. We can talk about how to look at credentials and whether or not they're qualified to work with you.
So if we're taking it a step back, why would we want to see someone?
Yes. Do you want me to talk about that?
Yeah, let's go there.
Let's talk about that.
Let's go there first.
Okay. So here's the thing, right? Any reason is valid.
Yeah.
And, there is a certain, most often what happens with my clients is I get clients who are concerned that they're taking up a space that somebody else needs more. And we all take up space in the world, right? There's no way to say someone's life experience is more important than others. Like, yes, there is so much unmet need in this world. And as a single therapist out there, I'm not doing a very good job meeting all of that unmet need. And the profession, you could argue, is not doing a very good job. But we're doing the best we can. Mm-hmm. And we're working with the people who want to work with us. And I think if you talk about what's effective therapy, it's if you're invested and engaged and you want to grow and develop in some way. And that growing and developing might be, I want to stop hearing voices. I want to be able to get out of bed in the morning. I'm so depressed. Or it might be, I don't particularly care for my job and I bicker with my husband a lot and I just like to feel better.
Mm. Or I just need to talk to someone because I don't know what's going on, but I feel
off.
Not me. Yeah.
Or I just don't have anyone to talk to.
Yeah.
That's a good enough reason.
Yeah.
So I do personally take a development stance on therapy in terms of it's not symptom reduction is really an important part of the process, but it is not the fulfilling and satisfying part of the process. It brings relief, but then once symptoms have reduced, then there's space for someone to grow.
Can you go into that a bit more? So what does that mean, symptom reduction? So what is someone coming in with and what is,
Like I'll take a kind of common one, I think, is panic attacks or anxiety attacks. Mm-hmm. If someone comes in and says, I'm having anxiety attacks, we can sit down and we can work on how do you manage an anxiety attack? And once they have it managed, for that person, it might be, okay, that's good enough. That's all I really wanted from you. Another person might manage them and say, but I don't want to have them anymore. Mm-hmm. And so then we keep going. And once the panic attacks have subsided or the anxiety attacks have stopped, a space will open up. Feelings will come, right? Because anxiety is a state. It's not an emotion, right? So it's a state that warns you of something. So it's usually warning you about an intense emotion that your body's afraid it can't handle. So once we take care of the anxiety attacks, then we're left with this intense, almost intolerable emotion. And so then that person says, I want to keep going. I want to learn to tolerate that. So once they learn to tolerate that, that opens up another door. Then they're able to do things they weren't able to do before. And now they start doing those things and then they get scared again because here's new stuff. Here's more uncertainty. Here's something that's even scarier than anything they've done before. And so now maybe they want some help holding that fear. Maybe they want to push even further. So I think it really, let me say, when are you done in therapy? Was that saying how long is a piece of string? Mm-hmm. Except that you can be done whenever it feels like enough. And I do see sometimes clients waiting for permission to finish. And that usually means there's another bit of work to do, right? And that bit of work is someone taking the full authority over their life. So as a therapist, if I'm seeing that, I'm mentioning that, and we're talking about it, and then that person decides whether or not they're leaving me. I don't decide that they're leaving me. If I'm deciding, it's premature.
Yeah. that whole process, to anyone who potentially is thinking of therapy, that could come across as really scary. Like that, like one thing opens the door to another thing, opens the door to another thing. And you said you hold space, you go through and hold that fear for them. Correct me if I'm wrong. How do you do that? How do you make someone? You're not making someone like. How do you make them feel like it's safe to go there?
Look, it's a great question. It's not easy to answer because it is a little different. For everyone.
Yeah, of course.
But a metaphor I like to use sometimes is training for a marathon.
Cool.
Because that's a long race. And if you've got someone who's just started to run and they're getting puffed after 50 meters, you don't say, okay, so let's plan your marathon training. I mean, occasionally, right? Occasionally there's somebody who's never run before who says, this is something I want to get done in my life. But mostly it's once people get into running. And once they're running, I mean, I know that's how it happened for me, right? I was running every day so it'd be about 10 Ks. And someone that I worked with who ran a lot of marathons said, that's the base training for a marathon. Have you ever thought about it? I thought, no, never. That seems enormous. And then I thought about it and then I took it on. And it's always stuck with me because in the training program I did, so I only know this in miles, forgive me. The marathon is 26.2 miles.
42.2K.
Okay. And the longest training run I did was 20 miles. And then the base training, which is about 6 miles, you're supposed to your body just knows that so well you can do it in your sleep kind of thing. So on that very first race day, I had never run the whole distance before and I had no idea if I could do it. And that's that's enough fear, right? So to come back to therapy, I don't remind people that there's 20, what did you say? How many Ks?
It's 42.2 kilometers.
Thank you. I don't remind people that they're like, you're 3 Ks in, you still got a long way to go. I said, tell me why now and what are you hoping for? What can I help with? And then we break it down, right? Once it needs to feel good. That's one thing is it's terrifying, right? There's not a lot scarier than therapy, really. And it can be really, really hard. But there's also so much joy in it. So it's important to stop at those moments of joy and say, look what you've done.
Yeah.
This is remarkable. And it is your free choice whether this is enough or you want to go further.
You mentioned intuition before. That was in regards to finding the right person. But in terms of what we're talking about right now and that whole process and, 42 kilometers, because it's going to be hard. And if we're going with that metaphor, the training's never easy and it never really feels good.
Yeah.
You feel sore. Like in that sense, when we're going through therapy, how do we know that we're either progressing if it still doesn't feel good?
Yeah, that's a really good question. And it is, I think, sometimes it depends on the pain someone comes in with. One reason why the Australian government rebates 10 sessions a calendar year is because there's a lot of research behind that 10 sessions, that 10 sessions tend to be enough for significant symptom alleviation for a lot of people. Now,
can I ask a question with that 10? Is that 10 sessions, is that monthly? How close together is it?
Now, I know I've read studies on this, and I don't have the best mind for the details of a study. If my memory serves me correctly, that's once a week.
Okay.
Yeah. Cool. I do know that there's sort of magic numbers. 10 is one of them. 30 is another. So 10 sessions tends to be enough for symptom alleviation. That's significant, noticeable, right? So if you say, okay, you've been dealing with this issue your whole life. You come in with me and suffer for 10 hours and it's going to start to feel a bit better. 30 hours is a harder sell, but I rarely have people leave before 30 hours. And 30 hours is the kind of point, again, forgive me, I can't cite the study, but where change becomes more enduring. So the problem with the 10 sessions is you go back and do that every year. And you might cover, for certain kinds of symptoms, you might cover that same ground. So it's kind of like tending to a wound, like you keep strapping it with tape.
Yeah.
And the tape is really helpful, but next year you're going to need the same tape.
I think that's really important to know, because if there's anyone out there who has had therapy and they've done, maybe they have done 10 sessions, maybe they've done more, but potentially it's been spaced so far apart for whatever reason, and they're not getting maybe the progress that they thought they would, or maybe hasn't come quick enough, maybe they're not where they are want to be at. So this is really important to understand.
Yes. Yeah. And in fact, I think it's less important to go by the number of sessions than how you're feeling in the sessions. And I would say there's probably two guidelines that I would pay a lot of attention to. Is one, are you feeling understood? Does your therapist get you? If you feel understood and listened to, like deeply understood, change is probably happening. Because that is the rarest commodity, right? Is the kind of listening that doesn't interfere, doesn't fix, just it really gives space for someone to be themselves, right? And we have so little of that time in a day. So being understood, and what was the other one? Oh yes, how does your therapist take feedback? So if you're not seeing anything change, bring it up. How do they handle that? What happens out of that session? Because sometimes you think something might be glaringly obvious about you, but it's so covered by layers and years and maybe shame, maybe it's pain that's like not even able to be articulated yet, doesn't have words yet, but you feel it so deeply. You're so sure that everyone in the world can see it. And your therapist is missing it. And they think they're being helpful and saying good stuff. And if you come in and you say, hey, here's what I feel, or I feel worse after the sessions than I do before them. How do they handle that? Do you feel more understood after that? Do you understand more the process that you're in after that? Or do you feel dismissed or let down, or like the answer is just kind of a fob off? That really tests the strength of the therapeutic alliance, as we call it.
Yeah. And if it's not great, leave. Yeah. Even if you've spent years or
oh my goodness. And this is the hardest one. Like I had a colleague back in the Bay Area in California whose entire job was helping people decide whether or not to leave their analysts.
Oh wow.
Because back there, when you go into analysis, and what this I'll cover when we come to the difference between different kinds of therapy and different qualifications. Analysis is often multiple days a week. So you're making a really big investment in working with that individual. And it's very deep work, and you can get really tangled up. Like you're opening things up and you're so vulnerable, and they go really deep with you. And sometimes the work just stalls. And is it stalled because you've reached this depth where you're both just kind of like swimming around in the dark and you're going to find your way through eventually? Or have you learned all you can with that person, right? Have you gone as far as you can with them?
Is that something that happens here in Australia?
Probably not so much.
Yeah, I've never heard of that.
Yeah. I mean, analysis, yes. Yeah. Like there's a psychoanalytic institute here in Adelaide. Okay. It's very, very small.
Yeah. They generally are.
Yeah.
In Adelaide.
There's a much bigger one in Sydney.
Yeah.
And there's a Jungian Institute as well, which is another kind of psychoanalytic training. I think it's pretty wonderful. It doesn't guarantee you're going to get the best therapist, but it does guarantee you have a therapist who's been through their own therapy, who's had extra years of supervised training post the registration. So you're going to get someone who's got some depth in their training, but they're probably going to want you to come more than once a week.
Yeah. And so, we said right at the beginning, how do we find the right person? Is that part of the checklist that we should be looking at, whether they've had their own therapy? Like, how do you figure all that out?
Well, look, I think you could ask.
Yeah, okay.
I mean, not every therapist is going to answer that question, but if someone asks me that question, I'm going to answer. I don't understand actually why someone would really want to be a therapist without sampling the...
Yeah, I agree. It's the same thing with massage. Like, how can you become a massage therapist without experience what massage is? And from different types of modalities as well.
Yeah.
So I can understand.
Or like a personal trainer who doesn't enjoy training.
Yeah, that's weird.
Yeah. And it's sort of, I think for me, the way I approached it was I can't sit in a room and ask. First of all, I can't ask someone to go deeper than I've gone myself. I do have to ask people to do things I've never done myself because they struggle with different things or facing different battles. But if I don't know what being at that level is like myself, how can I be good company for them?
Yeah.
So, actually, when I went to graduate school, they didn't mandate. A lot of the American grad schools mandate therapy for the therapists, and ours did not. And that was kind of a controversial choice, but they said to us all in the sort of, like our intake, we expect you to be in therapy the whole time. The reason we don't mandate it is because we don't want to tell you when is enough. If we mandate 10 sessions or 50 sessions or 200 sessions, then people are going to think we're done when we get to that number, which is a little bit of a tricky bit about the mental health care plan system in this country.
Yeah.
Is people think they ought to be well after 10 sessions. And it's, again, if you think someone's been struggling with something their whole life, and you're going to give me 10 hours to help them, and then they're going to feel bad that they didn't manage to get better in 10 hours. They're like a day and a half.
Yeah, exactly. Yeah, it's a whole nother set of issues. Yeah, that opens another door. So back to finding that right person if you've not.
That's
okay,
good.
Cool.
Yeah. So look, I think the most important thing is, how do you feel with them? I mean, I've had people who tell me they pick me out because of my picture, right? It reminded them of a family member, or they just liked my smile or something. Other people have been my voice. Some people, because I'm American, and would understand their feeling of being like an outsider somewhere, or, they want to move to America. Whatever it is, right? The reason is, it might feel fluffy, but it probably isn't. Yeah. There's probably a deeper intuition at work.
Yeah.
And then you got to kick the tires a little bit. Don't be afraid to ask questions. What is your orientation? Is a good question. What is your theoretical orientation?
But what does that mean to us though? Like, will we even understand that? If we ask the question, they tell us like, wait,
So that's a good question. I don't actually think there's so many different theoretical orientations, and I promise I will go over different qualifications, because that's a basic part of it that people really like. It's not explained to people very well, that the difference between a psychiatrist, a psychologist, a counselor, a therapist.
Yeah.
But if you ask what their theoretical orientation is, what you want to hear is, one, do they know how they work? Can they say something about it to you? And can they say it in a way to you that means something? Because mostly, if you get someone who says like, well, I put my hands on your belly and then I burp and then I get the demons out, right? It's not empirically validated. So mostly what people are going to give you is something empirically validated. And then if you get there and then they put their hands on your belly and they burp, leave.
Cool.
No, that is a technique, by the way.
Really?
Yeah. It's not a therapeutic technique. I can't remember what tradition does that. It's an energy thing. Yeah.
Energy modalities are very interesting.
Very, very. And it's such a gray area.
Yeah, completely.
Right? So if you want to know what is empirically validated, you can look that up. Now, I don't have the resources on the top of my head, but if you say, according to the APS or according to OPRA or according to the APA, which is the American Psychological Association, which is kind of where most other psych associations take their guidelines, is what are the empirically validated treatments? And there's a list. Okay. So you can compare, what does your therapist use anything on that list? Because we've all been trained in them.
What are they? What are you trained in?
So for me, I was trained in psychodynamic psychotherapy, which is an insight-oriented type of psychotherapy. And okay.
Sorry.
So it's empirically validated in a few different ways for several different disorders. We'll get to what's problematic about empirical validation as well. But it comes originally from Freud. So it goes all the way back. And Freud looked at psychodynamics as in the dynamic system within all of us. So, and he looked at it as a system of conflict. And you might have heard of this, right? That every dream you have represents a wish and a fear. So if you dream about, I don't know.
I dream some weird shit.
Yes,
like
we all do.
Monkeys chasing me.
Yes. Yes. Okay. I'll go with monkeys chasing you.
Okay. Do you dream? Where did this come from?
So Freud would have said about monkey. Well, okay. I will presume I know what Freud would have said, but in his model, it would have been something like, you are trying to chase out the primitive aspect of yourself. You know, monkeys are these ferocious, sexual, aggressive beasts, and you're conflicted. You've brought them into your dream because it's part of your id, and now you're trying to chase it out. That would be part of your superego. So it was basically, his whole model was that everything is a wish and a fear, a wish and a dread, and that we are just creatures of conflict, and that we have to fight to keep down our id desires or at our basic, basically sex and violence.
Yeah, right.
So that we can be good members of civilized society. And this was revolutionary at the time because he was saying we have impulses outside of our control. And we don't know about them. We don't know that they're driving us. Now, modern psychodynamic psychotherapy is not that.
Okay.
But it does look at inner conflict and ways that we have to kind of unknow things about ourselves so that we can fit into what is wanted from us.
Mm-hmm.
And in that regard, right, the therapy is learning to know these things and accept these unknown or disowned parts of ourselves, accept that we have an unconscious that gets up to all kinds of business, especially in our dream lives, and allow that to be, right? So it's basically a therapy of self-acceptance, but it uses a lot of fancy, like, technical language.
Right.
And what I came to believe over years of learning it, a little bit too much intellect. So I was also trained in Jungian therapy, depth psychology, which I'm sure, if I can remember, if there were some studies that validated it, probably. The thing is, the Jungians are not very interested in being accepted by, like, the establishment. So the thing about empirical validation is someone's got to pay to study it.
Yeah.
So it depends on how much money's been put in. There are countless studies done on CBT and ACT that prove it is effective, and it is. So it's a really good, it's a really safe way to practice. But what we also know from studies is it doesn't matter what the theoretical orientation is. What matters is the alliance between the therapist and the patient.
So would we really be interested in what they do then?
I don't think it's as important as whether or not the therapist is trying to help you understand the way they work.
Okay.
You want to know, right? You want to know, are they capable of practicing within the minimum standard, which is to use an empirically validated approach.
Right.
You don't want them burping over you.
I don't want anyone burping over me.
Right? But what you want to know is, one, do they know what they're talking about?
Yes. Yeah.
Right? And two, are they going to put in the effort to try to explain it to you in a way that makes it clear?
Mm-hmm.
When people ask me that question, I give them a list of the modalities I've been trained in and use most often. And then I explain to them that it won't be until we've had a bit of a consultation period that I know exactly what my approach will be with them. And even that changes.
Yes. Yeah.
But then I try to give a sense of, from what little I know of the person in our phone chat. And I usually have a phone chat, though not always, with clients before beginning, is to let them know kind of how I think I might work with them.
Mm-hmm.
And that's not about the theoretical language, right? That is a minimum standard of practice.
Yeah.
So things like internal family systems is, I think, a fabulous approach, and one that I was trained in after my education. Emotion focus. Okay. Internal family systems, that it does come with a lot of jargon, but basically, and it looks at the way you've internalized family relationships and the way you basically function as a little family inside. So there's a part of you protecting, a very vulnerable part of you, and that protector might be willing to sabotage you in doing new things. Let's say you're afraid of skydiving and you really want to go.
No, I don't want to go.
Okay.
I'm really afraid of it.
Yeah, I don't want to do it either. But let's just say, right?
Sure.
Like your protector might throw you down the stairs the day before you sprain your ankle, right? The protector can get up to all kinds of things, might lead you to avoid relationships that might be really nurturing for you because that protector saw you get hurt too many times.
Yeah.
Right. So it's not going to risk that little internal child. So it's learning to interact with those different parts of yourself.
Right.
I'm really oversimplifying there.
Sure. But to understand, that's a good baseline.
Yeah. So a therapist who's versed in the system of the family, whether that's the external family or internal, there are so many more. The list goes on. There's narrative therapy, which is how we tell the stories of our lives and how we can rewrite those stories. It's a fun one.
Alex, every time you mention something, I want to go deeper into it.
Okay. We can have another chat about the different orientations.
Okay.
Let me just go back and read.
Where are we again? Yeah, sure.
I might need to do a little reading, so I don't want to step on anyone's toes that uses a different system than I do.
Fair.
But I really think it needs to be, you've got to take a leap of faith. Therapy itself is a leap of faith. And if you feel drawn to someone, try it out. And the thing, people, it takes so much courage on average. And I don't remember if this is for an individual or couple seeking therapy. I just remember reading this in some study somewhere that on average, it takes 6 years after the initial thought about going to therapy for someone to actually do it.
Yeah.
So it's terribly courageous. As I know, just going, give yourself credit for that. But also, if you really hate it, go to someone else. Like, if you think about it, if you go get your hair colored or you get a haircut and they do a bad job, you don't just stop getting haircuts.
Yeah. Or if you don't like the trainer, going back to the fitness metaphor, or those coaches, you've got to connect with them.
Yes, you have to connect. And just because one is no good doesn't mean everyone is.
Exactly. Yeah. I want to go deeper into what you said before, the different types of therapists, psychiatrists, psychologists. But before we do that, I do have a lot of people who are athletes. So I know there's a lot of sports psychologists out there as well. Does it really matter who you see, whether it is a sports psychologist or just go see someone just to get started? Like, what?
That's such a good question. And I think it comes back to fit because, and I work with, as you know, a fair few athletes.
You work, and and
it's something I was so not, in a way, I always was involved in sport, but I'm not a sporty person. It was never an area that I was like the best in.
Mm-hmm.
Part of why I'm good at it is because, competition is awful to me.
So I agree. I turn into a horrible person as soon as.
Oh, really? Oh, I want to see that.
Ask Marina. She's seen it.
Are you
I'm not that bad.
You cutthroat?
I just, what a word.
Yeah. So for me,
I'm not a sore loser though. Just put that out there.
The story I tell is that when I learned to play chess, I didn't want to play the white pieces because they move first. So I don't like to initiate the competition. I am so unwilling to enter the arena. I need someone to punch me in the face first. So when these athletes come to me, like I am so in awe of that energy that they bring to initiate the process. Like what they do on a daily basis is just so terrifying to me. But because in various other places in my life, I was really immersed in a competitive world and we live in one, I get it. And I get all the stumbling blocks because I stumbled over all of them. So I can bring that level of understanding. And I don't know if it's through my experience with athletes or maybe through some of my family experience with academics, where academics was held as this sacred thing that I always needed to excel in. So everything else came second. I do have an understanding of the different way that the expectation of a career in sport is very different than not all corporate jobs. Some of them they're very much the same, but it kind of swallows up a life. And not all therapists can kind of roll with that. There is sometimes you'll go see someone who's so far from the sports world that to them it just strikes them as so wholly unhealthy. The athlete just needs to get out so they can become themselves. But the fact of the matter is, and here I'll paraphrase Carl Jung, is that we pay a high price for achievement. It comes with a lot of personal sacrifice. And humanity cannot thrive without people in the community making those sacrifices. We can't have what we have without a Martin Luther King, for instance. We need that. And, it's up for debate. Do we need it? Do we need it in the sports world? Do we need to watch sports? I don't know. Probably. We always have.
Yeah. Yeah.
So I think to understand the seriousness of that, of the arena on which that person's life is playing out, like that's the most important thing. And then I don't think it matters, but that's just my bias.
Yeah.
And partly I have seen people have experiences with like tremendously wonderful sports psychologists. Mm-hmm. I've seen people have experience with tremendously wonderful like mental coaches who have very few qualifications at all, but are wonderful. And then I've had people have experiences and they've come to me after those experiences with sports psychs who either just kind of gave them a list of techniques, which, you can read in any book or watch them on YouTube, or who were too invested in the athlete winning. It was too close.
That's not part of the job, is
it? The winning?
Yeah.
Well,
to be that invested?
Depends on, and it really, this is part of the problem where, say you work for a club, you're going to be judged on your KPIs. Yeah, and part of that is to get your athletes across the line. That's what I can't imagine doing that, frankly. I suppose I wouldn't be opposed to trying to see if there's some way to walk that line where you don't get, if your job's on the line.
Yeah. Your job to get the athlete doing the thing that they're paid to do.
Or with a lot of sports psychs, right, they're afraid they're going to get fired if they don't help get a result right away. And it's slow work. And it's slow work at the beginning. That's the hardest bit of it, right? It's like, and I do think culturally we're changing, right? Even if you look at, say, declining popularity of sports with long learning curves. We're impatient.
Totally.
Yeah. And it's the beginning part that's most important to the change that comes later.
So when you say beginning,
I don't know what I'm talking about there. Could be 10 sessions, could be 30 sessions. Right. It could be, and this is going to scare everyone, I'm sorry, 3 years.
Wow.
3 years tends to be a time where the work really takes off.
Wow.
I don't say that in a first session.
Exactly.
And it is, I think, where was I come across this? That someone said psychology is the only place where you go in with one problem and come out with 12.
Yeah.
And it is. I had a professor once who just decided that it was all a racket, like one-on-one individual therapy, that he went into organizational psychology. So because it's the only place, right, where therapy, you come in, you make the customer do all the work. Every time they get a little better, you just tell them they have a new problem. And and it's really ineffective to treat one person at a time. And to me, there's a bit of a conflict there in that, it's got to be effective work somehow if it's ineffective to do it one at a time, right? So he was looking at, and there's validity to this. He wanted to treat a group of people through having a healthy environment where people can flourish. I do think that's important. And I do think often therapy neglects work life. We spend a lot of our waking day at work. So if we're not talking about work, if we're just talking about childhood and your relationship with your mother or your father, we might be missing something important.
What comes first? Like, how do you know what's the important part to start with?
Well, that's where it comes to the therapist's intuition, yeah?
Right, yeah.
And that's where that's the art of it. That's the art of it. And that's what's hard to explain. I have to go case by case based on what people tell me.
Yeah.
And I do, if someone tells me they have the best family ever and there's no problems in their family, that's never true. So there's something there, but they're also letting me know, not now.
Exactly.
Don't go there now.
Talk about it. Yeah. Yeah.
And you've got to push, but if you push too fast, too hard, you push someone right out the door. Mm-hmm. So there's a balance always. And I think it's really interesting to get a group of therapists in the room to find out how everyone does it so differently. Mm-hmm. Speaking of group of therapists, I'm aware I still have not answered your question. So if you want to see a therapist,
yes,
there are a few different kinds of therapists you can see here in Australia, right? You can see a psychologist. You can see a clinical psychologist.
Oh, stop. What's the difference?
Okay. Different levels of education. Okay. A registered psychologist has a bachelor's level degree. So they have a uni degree and then some supervised training.
Right.
A clinical psychologist, they might also have an honors. I don't actually remember all the ways you can become a registered psychologist since I didn't do my training here, but they do not have a doctorate in psychology. And I don't believe if you have a master's level, then you're a clinical psychologist. A registered psychologist doesn't have permission to diagnose. So they can work with you, they can counsel you, but they're not equipped to give you a diagnosis.
What would be a diagnosis? Why would you need that? If what I want is to talk through things, why would I need a diagnosis?
You don't.
Okay, great.
Yeah. Okay. But you might need a diagnosis if, for instance, the law was involved in some way.
I see.
Or you needed to prove that maybe after a car accident you have PTSD.
Right.
Then you need a clinical psychologist to diagnose, or a psychiatrist.
Okay.
So psychiatrists can prescribe medication. They are medical doctors. So psychologists are doctors of philosophy.
Okay.
And the psychiatrist may or may not have a lot of training in therapy. They may or may not have an interest in therapy. So you could have all kinds of different experiences with your psychiatrist. If you're going for medication, you might talk for 15 minutes and walk out with some tablets. You might talk for an hour and a half. They might want to see you for an hour every 2 weeks. They might say, come back in 6 weeks for another 10 minutes. We'll see how those meds are going. They practice so differently, and that does come down to preference. What do you need the psychiatrist for? What other kind of support do you already have in place? And how much do you want to be listened to? So finding a really good psychiatrist who has time and inclination to sit and really listen, that's tough. Because they're so slammed in this country. There's just such a shortage.
Okay.
Yeah.
I would assume they would be more expensive as well.
Yes.
Yeah.
Yeah.
Okay.
Yeah. And then there's also, you can see a psychotherapist.
What's that?
That is someone who's got training in psychotherapy. So
Difference being psychotherapy and psychology.
Look, I don't know exactly how the program works here, but it is basically the psychologist has training in usually in assessment, usually in more the science of the mind,
right?
A little bit more neuroscience, a bit more about psychopharmacology. We're educated in it, even though we can't prescribe. More training in sort of deep psychological disturbance.
Okay.
A psychotherapist is a counselor. And so they actually, depending on where they did their degree and what kind of work they've put in personally themselves, do excellent work. And they're usually quite a bit cheaper. So if you hear of a good one and you're on a budget, I know, seeing a psychologist can be really expensive. A psychotherapist can be a great option.
Right.
They also often couples therapists.
Mm-hmm.
And then there's also licensed clinical social workers. So a social worker who can practice therapy. Also, they can have some very, very good training and be very experienced and skilled. So there are a few options.
And the counselor.
And counselors. So counselors there's so many different ways to be a counselor. Oh, wait, coaches. I forgot about coaches.
So many.
So many. Yes. And so counselors, they have a counseling degree. Again, they could have a specialty like chemical counseling.
Drugs,
okay. Drugs, alcohol, that kind
sure.
of. They could be, some of the best training people get, the lifeline counselors, for instance. So they don't necessarily have done a course in it or a degree, but they've gone through the lifeline training, which is fantastic.
Right. Yeah.
So they really know how to listen. So it depends. I think the medical model is that the more severe the case should go to the more to the clinical psychologist, and which is what I am.
Mm-hmm.
But I don't find that that's actually what happens.
What happens?
What happens is people of all levels go everywhere.
Anywhere and everywhere.
Yeah. And that very often, and this is what happened in America too, some of the people with the greatest need are being seen by the greenest of clinicians, usually young people in training.
Yeah.
And that was my experience when I was in training.
Mm-hmm.
And, living in a capitalist society, I don't see how we're going to change that.
Mm-hmm. Yeah, that's a shame.
Yeah.
How do we know you mentioned intuition and how you feel and feeling understood by your therapist is a good way to know whether, you've got a good one. But how do we know if we are progressing? How should we feel? What should we look out for? Are you or anyone else giving us homework? Should we be doing that homework? Does that mean we're getting better?
Yes. Yeah. Okay. That is just such good questions. And I don't know how to answer the progression question across the board.
Sure.
I can tell you that there's sort of the simple way, and this is usually at the beginning, is do you feel a little better? Right? Especially when you leave the session. Sometimes you're going to feel worse because you're going to have brought up things or face things, and maybe you're going to walk out there still feeling ashamed or still feeling uncomfortable that you spoke about that. But most of the time, you're probably going to feel a little lighter. And just that little bit of joy that you were understood. Like, I don't think that you can mistake that feeling. It might be uncomfortable to be seen, but usually afterwards, it's just a satisfying experience. And know too that if that's happening, probably things are changing. And then you start to look at, you look around you and you look at your relationships. Is there some flux happening? Is there, say, if you're in a long-term relationship and you're changing, is that starting things up at home a little bit? That's probably a good thing.
That's so hard to come to terms with when that happens and the relationships that you felt safe in and comfortable in now no longer feel that. You don't feel safe. You don't feel comfortable. You don't feel seen, heard, understood. Everything just feels thrown in the air.
That's one of the reasons why it's such a courageous thing to do, because you really are risking it all.
Right. And so important to continue to see.
Yes. So one thing,
so you do have that support.
You know, one of the things that I do say to people is if it feels like everything that's wrong in your life is your mother or your father's fault, it is not time to stop therapy. You need to keep going. Because if you get to that place, right, that's an achievement, getting to that place, right, where you know you're angry and you know you went through some stuff. And that it wasn't all your fault. But if you get stuck in that blame place, you will walk through life feeling like a victim. And so that's time to push on. But people often, and they often do it because they love their parents and they're feeling protective and they don't want to go any further with that anger. It's already too much. It's already too scary. So they just want to back right out of that and leave it right there. The problem is you cannot unknow something once you know it. So it's kind of like once you start down on the path, if you turn around and try to walk back, first of all, it's a long walk. And second of all, it's an impossible walk. So you kind of have to keep going forward.
Let's talk about homework.
Yes.
Do we get it? Or
get it?
Or does that not matter? Like,
this is my personal take on homework is I rarely give it.
Okay. What would we be given?
Okay. So if you go for cognitive behavioral therapy, CBT therapy, or CBT schema therapy, which is kind of like the deeper version of that, you are probably going to get homework. You're probably going to get homework every session. That homework will be useful. The reason I don't give homework is because I find, especially at the beginning, people don't do it. And then they avoid coming back.
Because they didn't do it.
Because they didn't do the homework.
Yeah.
Or they do their homework in such a way that they feel so guilty they haven't done a good enough job. And I personally, my personal take on techniques, which is say you need to do a mood chart. And that's very useful to like just kind of track how are you feeling on a given day, especially if you're depressed and you think like when you look back, the lens it's like a gray colored lens. So there might have been a few moments where you felt good, but when you look back, you can't remember any. So a mood chart's really useful. It's like, look, 2 Wednesdays ago, you were happy. Now, it's good to have that evidence. But if you're really depressed and you got to do a mood chart and you're going to feel down about having to do a mood chart. and you're probably going to avoid doing the mood chart. And you might only make notations of the mood chart for a couple of days and say, see, look, I'm really depressed, and give up. And then you think, well, if this is what's supposed to make me better, I'm not going to get any better, and give up.
Yeah.
Now, I think that once we've explored and given someone an experience of who they are and some sense that this can change, then homework can become useful. But very often at that point, my patients are assigning themselves homework. They're telling me what they want to do, and I can help keep them accountable. I can help understand what happened, what didn't happen. But when the idea of the homework is coming from me, I don't know. I just find that it's not. Also, I feel like we have all done enough homework in our lives. I don't want to grade homework. Yeah. I don't want to. I don't even like saying homework.
Yeah.
That said, the exception is when I work with couples.
Tell me more.
I do give couples, and I try to call it things other than homework, but it's such it's a format we're all familiar with. Couples therapy is more directive and active, and it's helpful for the couple to continue to interact with each other in ways that they did in the session, and to try things like I'll be helping them through new ways of communicating. And let's say, okay, now try this at home and see what happens if I'm not there to sort of stop you and redirect you. And can you learn to do that yourself? So they're more like experientials. I find that to be, there's some couples I don't give any homework to, because giving the homework itself is a sabotage. Because there's someone who's had a bad experience with being given homework or graded or judged or evaluated or shamed. And it's just too painful to do it. We can work around that.
Yeah. Before we came into this, you gave me some ideas of what we could talk about. And you wrote some things down, and I read them, and I'm like, oh, I never really thought to go down that path. And that was the boundaries in therapy. I thought that was a given. So, I mean, we won't go, I won't mention more. Let's go there first.
Okay.
What do we need to understand about boundaries? Isn't that part of, shouldn't that be part of it?
It is part of it. It is part of it. But here's what I've experienced is, I've had many clients come in and tell me about an experience with a therapist where boundaries were crossed, and that they didn't even know they were entitled to those boundaries. And particularly with young people who are so used to so much transparency, their lives are online. And then also I find that people do generally know what the boundary is supposed to be. The session lasts 50 minutes or an hour. The therapist doesn't tell you anything about themselves. And, they take then responsibility for maintaining those boundaries. And those are actually the therapist boundaries. So for instance, you can ask your therapist anything you want to ask. They need to decide whether they need to protect their own boundary by not answering, or the professional boundary between the two of you by answering or not. The patient doesn't have to be responsible for that.
Right.
Like if you want to know, does my therapist have kids? You're not breaking any rules by asking. The therapist might not answer the question.
Right.
Which is different. And I think that's important, because that's not about, I think people often feel too much shame there. And we need to all give ourselves permission to have our own boundaries. And if you feel like you've done some terrible thing to your therapist by asking them a question that they don't want to answer, then what does that say about what you're entitled to as your own boundaries? Like that we have to be so accommodating and open with people, or know what everyone's boundaries are. In these days of trigger warnings and people being very vocal about sensitivities, and like a sentence that really bothers me is, "You triggered me." No, that's not how a trigger works.
Oh.
A trigger exists in the person.
Uh-huh.
We need to be responsible for our own triggers. Right? So
the sentence would actually be, I am triggered.
Yeah.
Yeah.
I'm triggered. Yeah. And that's, sorry.
I was just going to say, but it was because of something someone said.
Yes. When you said that, I felt triggered.
Yeah.
It's not, you've triggered me by bringing that up.
Yeah. We're just throwing away a responsibility.
Yes. And our power. That's the thing. Like that, we are throwing away our capacity to keep ourselves safe. We are then saying, everyone else around me, you stranger, you person who doesn't like me, you person with 10 other things on her mind, you all have to keep me safe. I can't keep myself safe.
You have the power to make me feel better. Amazing.
Yeah.
Whatever.
So I actually think that it's great for patients to ask their therapists a question or two now and again, and to hear a no, I'm not going to answer that. And then to talk about what that feels like.
Mm-hmm.
Right? Because the therapy is the one place you really get to talk about what those experiences were like.
Interesting. Anything else around boundaries?
Well, there's lots of little things, right? Like, that ethically, therapists are not supposed to accept gifts.
Okay.
Do therapists accept gifts for all kinds of sound ethical reasons? Yes.
Mm-hmm.
But if it gets into a pattern, right, where say you're bringing your therapist a muffin or a cupcake or a cookie every session because it makes them smile, and that therapist is taking care of other people all day long, and so they get this one little sweet treat and it's lovely, except that it's reinforcing something that in order to be loved, you've got to show up with a little extra.
Oh, there you go.
Yeah. So these little things, they add up over time.
Yeah.
And now therapists are people, right? So like if you're one of your therapist's favorite patients, you might know.
Mm-hmm.
And because there'll be little ways they're happy to see you. But if your therapist says, you are one of my favorite patients, that's a problem.
Yeah. Okay. Yeah.
And so when I talk about boundaries, it's mostly around, like clearly, like if the therapist is saying, well, let's have our session and then, let's go to the movies together. So we've talked about that. That's a problem.
Yeah. That's definitely crossing a boundary.
Yeah.
Mm.
Yeah. But it's to sort of, not the patient doesn't have to take responsibility for the boundaries themselves.
Mm-hmm.
So, if they say crossing the boundary every session, a therapist is in the right to say, hey, like, I can't work this way.
Yeah. So as a patient, how do we know if there is a boundary that's being crossed and whether we should find someone else?
Okay, so two things. Do you get a bit of an icky feeling?
Yeah, okay.
If you get
trust your intuition.
Yeah. And, if it's just a little bit, you might talk to your therapist about it and say, hey, when you complimented my new haircut last week, it was like, oh, I didn't like that.
Mm.
And you can talk about it. And then how does that conversation go?
Yeah.
Does that feel good? Like, do you feel safer now?
Mm-hmm.
And then if you don't feel like you can talk to your therapist about it, that might be a sign about the therapy.
Mm-hmm.
It might also be a sign of what your life has been like. So talk to somebody else. If you have a friend who's been in therapy, I really think that so much has changed in the past, well, since COVID for sure, but in the past decade about how acceptable therapy is. And people talk about it so much more freely now. And I think just keep going. Keep going.
Yeah.
Gossip about your therapists.
Yeah.
Get a sense of what it's like for other people. There is a lot of research in terms of how therapists say they practice, in terms of what theoretical orientation they come from. It doesn't match up with how people are in the room. People are just people.
Right.
So to demystify this, that there's some magic thing someone's therapist says to them and some magic contained way that therapist is, like some objective seer, who always can see the right thing. That's one thing. Look, we don't know the future. Exactly. We don't know what choice you should make.
Mm-hmm. That's on us. But guide us. You've said the role of the body in therapy. What does that even mean? How is the body? How do we use the body in therapy?
Well, if you think about it, I mean, even if right now, you're probably feeling a lot of things.
Yes. Yep.
And are you aware of, say, if you tune into your shoulders, do you feel?
I'll tell you what I'm feeling right now, and that is my calf, because my knee is driving into my calf with my crossed legs. So that is something that...
Yeah. So there's tension there.
Yeah.
So what would it feel like to put those feet on the floor? Yeah.
Oh, that's better.
Yeah.
Okay. Yeah. How does that work in therapy, though?
Well, sometimes it works just like that.
Okay.
But that's when I know someone pretty well.
Okay.
I'm not going to say like, hey, are you crossing your legs because you're tense?
Yeah, right.
But
So we're talking more body language or like the feelings in the body?
Feelings in the body.
Okay.
Feelings in the body. I mean, of course, body language is a big part of it. Like if you watch a therapy session on video, you will see all that unconscious mirroring happening. And sometimes I'll come to in a session and notice it, like I've had a drink and then my patient's had a drink and then I've had a drink and then I've crossed my legs one way and they've crossed their legs another and then I've followed suit and crossed my arms.
You side, I side.
Yeah. And that means things are going pretty well, right? We're
right. So that's a good thing.
It's a good thing.
Why is that a good thing?
Well, it mirror neurons.
What is that?
What are mirror neurons?
Yeah. I mean, I understand it.
So
logically,
we feel things as the other person's feeling things. So it means we're in tune with each other. So when a conversation's going well, you see a lot of things like, I'll lean my head this way, then you'll do it, and then you'll do something, and then I do it. And we don't know we're doing that. But it's, and this is the thing with a therapist, you can't do it self-consciously. You've got to just be yourself and let your body be in the session.
Moment. Yeah.
And then tune in with the client that way. So when we talk about being embodied in therapy, it can mean a few different things. One of them is the therapist using her whole self to tune in? Right? Is she just thinking with her frontal lobe, right? Is it too intellectual? Which is how I found some of my training back in my training days, was that, I would have these remarkable insights about my clients and deliver them in such an elegant package. And they would say, oh, wow, that's fascinating. And then nothing would change.
Right.
And it's because insight alone does next to nothing, right? It helps us see the bars of our cage. It doesn't help us out of them.
Oh, great. How do we get out?
We have to get out. We have to learn to tolerate the feelings, right? So we go up into our heads as a way to get away. It's like it's dry land up there, but it's dry, right? Nothing grows. Mm-hmm. We run from our feelings and take refuge in our heads, or we take refuge by disassociating from our physical selves. So for instance, one thing that I notice in my own body is if I'm with someone who's disassociating, right? So they're cutting off from their feeling experience. I often get very sleepy, like unbearably sleepy.
Wow. So that is like, I was going to say trigger. That's not the right word, but that's something that happens to you.
Yes.
Wow. You are so in tune.
It maybe.
Well, how else would you explain that?
Yeah, I think so. But it took me a while to be okay with that, because I would have to stifle yawns.
Yeah.
Occasionally I'd have a microsleep. And, there are times when a patient is intentionally boring, but I'm not talking about those times. I'm talking about when someone is trying to speak about something, or maybe they are talking about something quite serious, or maybe they're giving a huge amount of detail where they don't need to give a huge amount of detail. And I get so sleepy and I think I'm trapped. I'm trapped the same way they're trapped. So there's a part of them that's not allowed to be alive. And it's putting us both to sleep. And so sometimes I'll say, are you feeling sleepy? Or is there something's changed in the atmosphere? Do you notice it? And see what happens. If that goes nowhere, it goes nowhere. But every once in a while, or most often, I should say, I'll get something back like, yeah, I do. When did it start? It started back when I was talking about, and then we're free. We're awake again.
Do you explain what?
Sometimes, yeah. Yeah. Not usually once someone has more experience with that kind of what happens in those states. I suppose if someone's listened to this and then they come see me, then they will already have the explanation. Yeah. But we don't control this stuff. Mm-hmm. So, I use what's called a technique called reverie when I'm listening, which is I listen and I listen closely, but I don't force my concentration. So if my mind wanders and I start thinking like, oh, what am I going to make for lunch? Or, I start thinking about an experience from my own childhood, or a sense memory comes back to me. I think, how could this be relevant to my client right now? How could this, what is this saying about what I'm hearing? And then I can kind of use it to try to find them. Right. And really when you do like make an interpretation or an intervention, depending on what theoretical model you come from, what you really want to judge its success by is, does it help? So did it bring something more into the room? Did it bring something to life? Did it resonate? It doesn't matter if I'm correct about something. If it doesn't resonate, it's useless. Mm-hmm. Right? Does someone feel seen? Does it take them to a new thought themselves or a new experience?
Have you had a moment where, do you ask the question, what do you feel? How's your feeling?
So back to sort of like what I asked you is what you were aware of, right? It's I could see there was a tension, right? And I was feeling it more in my shoulder, but you said you were feeling it more in your leg.
Yeah.
And if we were going to go into the emotion.
Shoulder? Yeah. I actually have something going on. Shoulder. Recently.
Okay.
Yeah. Anyway.
Yeah. Well, I'm not always right, but feelings are physiological experiences, right? So, and it works both ways. If you've got an injury, a physical injury, it's almost like feelings are going to get stuck there, right? It's like a rough patch, like that's going to attract the lint of human emotion. So you hold stuff. And then the other way around, right, is if you hold stuff in a place that's particularly strong, like for me, my trap muscles are placed. And I'll notice by the end of the day.
I get a lot too,
yeah. Because they like to hold everything up.
Yeah.
And so we can work with those, physical experiences as a way of learning to tolerate the emotion physiologically. Because like, for instance, anger is such a valuable emotion, and it's such a loving emotion. And mostly we try to repress it, discharge it, get rid of it, go for like a run or lift heavy things or make it go away somehow. So we don't have the practice to stay with it while we're, say, sitting with our partner who we love very much and we're angry with them. How do we stay with that feeling? If we can stay with that emotion in therapy, and sometimes with that, I'll do visualizations. So we visualize experiences in the body.
Oh, I see.
And we do visualizations, imagining, interactions, something like the empty chair technique, right? Talking with the person that someone's afraid to talk to, but really staying close to the physical experience.
So sorry, when you said the empty chair technique, are you meaning there's someone in that chair, you put whoever it is that is bothering you or whatever in that chair?
Yeah.
Okay.
Yes.
Right.
Yes.
So with that, not that I have a whole lot of experience with Chinese therapies and whatnot, but you hear a lot about energy or emotions being stored in certain muscles.
Yes.
The psoas is one that gets mentioned a lot.
Yes.
And that sort of thing. And then, the liver is where anger is stored. I don't know if that's the correct term, stored, but these sorts of things. What are your thoughts around that? And does that come into play with, everything that we've just talked about?
It does. It's I hold open to all of that skeptically.
Mm-hmm.
And I don't know. Like I would say, I do not know enough about Chinese medicine to make a judgment. I do not know enough about acupuncture. I don't know enough about astrology. I don't know enough about I Ching or tarot or chakras. I am wary of anything that supposes certainty. Like the gallbladder is where this is, or that is your throat chakra. I often think that's just a way that certainty is like a sugar tablet. Mm-hmm. It's the certainty itself that appears to be doing the healing. For sure, we feel things in our hips. For sure we do. Anyone who's ever done yin will know that, right? That it's when you open the hips, you open up feeling. Is that something particular to women? Is that something particular to a certain kind of feeling? I don't know. Mm-hmm. It gets ascribed that way, but maybe it's because it's mostly women who go to yin yoga and open their hips. Yeah. And maybe mostly a lot of men say my hips are too tight to ever open. Mm-hmm. I don't know. I do know lots of great clinicians who incorporate those things like that into their practices and work still in an empirically validated way, but add in some color. Yeah. And there's so much we don't know.
Oh, totally.
There's so much we don't know.
And that's, I'm in the sense that when health professionals talk in absolutes, I still, like, how do we ever really know, can guarantee that any one thing is one thing when there's so much more research to be had around the body? The body is just so intricate and incredible and complex, and the same goes with the mind.
Yes. I mean, when I look at my own profession, right, the homosexuality was listed as a mental disorder for a long time. And so, psychology can also be quite dangerous. Mm. And just because it is empirically validated and there are medical exams to be passed doesn't mean that it's a sure thing. Mm-hmm. And, that we need to be aware that we're working with theories, and that theories can be disproven any day. And they're the best we've got for now. Mm-hmm. So, for instance, like I have close collegial friends who are also astrologists. I don't subscribe to astrology. Have I had my chart read multiple times? I have.
Absolutely.
And in fact, one of the most moving, a colleague of mine read the birth chart for my niece. And I have not forgotten how accurate, this was 9 years ago, how incredibly accurate she was. And she'd never met my niece. She lived across the country from her. It was wild. And then I know that what we do in our minds, right, and this is another theory, is we cherry pick what's relevant. We look at what's relevant and we dismiss everything else, all the other evidence. And in that, right, so if someone lives and dies by astrology, I think that's kind of dangerous. On the other hand, as a way of understanding our aliveness, if we're cherry picking only what we want, maybe that's not so bad. Maybe that gives someone a real picture of what they aspire for in their lives, and some belief that it could happen.
Yeah.
So, I don't know.
I think it's a huge thing.
Yeah. I will say, I am wary of practitioners in alternative medicine who, one, who are too sure of themselves, and two, who are not accepting of any Western medicine, or perhaps have had their own therapy. Because there's not any more evidence to dismiss, there's no evidence really to dismiss Western medicine out of hand.
Yeah.
I understand that there's a lot in the system that's broken. Mm-hmm. But when somebody says, your energy will heal you, it won't. We'll die. We all die.
Yeah.
So that is someone's coming from that perspective in their work, that there's some kind of omnipotent force out there that if you just have enough faith in it, it will take care of everything. That would set off alarm bells for me.
Red flag.
Yep. And in terms of boundaries too, you do want to know that someone's been educated and say practices, and it's just unfortunate, it's complicated, that involve laying of the hands. And I'm sure you would know this, right? Like Reiki, for instance. There are some amazing Reiki practitioners and there's some amazingly dangerous ones.
That goes for any profession.
Yeah.
Really.
Yeah. It's how, when you have the responsibility of people making themselves vulnerable in your presence, I think you have a real duty. You have a real duty to see as much of yourself and your own unmet needs as you can, so that you're not taking from people that more than the fee you're charging for the service.
Yeah.
I did just diss kind of alternative therapies, but now I will say something very alternative, which is the psyche likes regularity. It is, the more practical way of saying that is, when is the last time you've gone to see a personal trainer who meets with you, takes you through a workout, says, okay, here's where I think you can progress, now come back and see me whenever. They'll say, no, like weekly session, or we'll come back tomorrow.
Or even bringing it back to the very first analogy, which was the training for a marathon. Yes. You don't train every 4 weeks.
Yes.
In order to achieve a goal, you need to be really consistent.
Yes. And I think even to the point, and this is how I mostly run my practice, not everybody can do this. For instance, shift workers can't do this, right? Because their schedules are changing so much. And I always leave a couple of hours for shift workers because, they have it really tough. And then some people's work schedules or finances or just life they're not at a place where they can commit to this. But if you are, I highly recommend it, is same time every week, because the body starts to get ready. And it's like how it's Saturday morning when you wake up on Saturday morning. Yeah. It's like, this is Wednesday. It's my Alex day. And here's like, I'm getting ready to bring things up. And the courage is coming. The thoughts are coming. I'm starting to think about maybe I'll cancel the session. But I know that I won't, because then I don't get it till next Wednesday. So if you stay regular with it, it gets easier and easier to face the tough stuff. And the more tough stuff you face in therapy, the more satisfying the experience is. So I would recommend it sort of ideally weekly. If you can go more than weekly, that's great too. Fortnightly also works. I find, and there is research behind this, and I'm forgetting the phrase right now, but something like mass and taper, where if you meet at at a greater frequency at the beginning of the work, and then you can taper the sessions out. So it's just kind of like get traction, build up the muscles, and then you can spread sessions out. So very often people come and work with me weekly for a little while, and depending on their needs, that a little while might be 1 month, it might be 1 year, it might be 3 years, it might be 10 weeks, and then taper the sessions out, and then maybe increase frequency if they hit a speed bump or something big happens in their lives and they want to work through something a little more deeply. Yeah. I will say that there was one therapist, it was a French theorist named Jacques Lacan, and he's fascinating guy. I can't remember when he died. This was a while ago, but he really used language very deeply in his work. But he also said that the session is over when it's over. So
how do you schedule that in?
Yeah, exactly. I was wondering what his waiting room looked like. So, and he said he knew when they'd gotten to the thing that they needed to get to, and he would cut the session there. So a session might be 5 minutes or it might be 5 hours. And that's not a money-making, like you can't actually earn a living in the modern world working that way, but it's intriguing, right? Yeah. It's like, what if we had that kind of freedom to get to the thing and then finish up? And very often we have to finish up. Or once I had a patient say to me, it felt like, and he was very skeptical about therapy. And we finished a session on time once, and he had just started to bring something up, and he came back. He said, it felt like you were in the middle of open heart surgery and you just said, I've had enough for today. I walked out. And after that, we really got to work. After that, he was involved because he felt so betrayed by me. Right? I just ended the session in the middle of his emotional experience.
Wait, tell me more about that. Like what? That doesn't, because the time was up. Like the time was up. Time was up. And you go, time's up.
So I didn't do that. I do know. Like there's some therapists will even set like an
alarm or something.
An alarm. It just goes off. I take responsibility. I did do that one day when my clock broke, but because I don't like wearing a watch.
Yeah.
But I take responsibility for it. So I don't tend to say, okay, we've hit 50 minutes on the dot.
Sure.
You have to stop speaking now.
Yeah.
But I'll say, we need to wind things up. We're at time, or, it's fine. If I know it's someone who struggles to finish, I'll say 5 minutes from time. And I don't remember exactly what I did that day. I think I might have said we might need to leave this here and come back because we're at time.
Yeah.
And it was the first time he had a big emotional experience. Like I didn't even know it was coming, right?
Yeah.
I wasn't even aware yet that there was a big emotion that needed to come out, but it was from the heart, right? So it was a real heart opening for him. And I was like, well, I've opened your heart up.
Yeah. See ya. Good luck with that. And so did he tell you?
He did. He came back
there or after?
He came back the next week.
Okay. Yeah.
And he might have canceled one before he came back. I can't remember. But this is the thing. Like, if you get angry with your therapist before you quit, tell them.
Yeah.
Tell them, because that is where the good stuff is. Like because that's what you didn't get to do, is talk about it. Like, come back and talk about it. And then if they don't show up for you in that conversation, okay, quit. Mm-hmm. But see how it goes. And it might be a conversation that lasts a few sessions, actually. Mm-hmm. Yeah. And that was actually the moment that really got the therapy kick-started.
Wow. Because it opened the door.
It opened the door.
Yeah.
It opened the door to the heart.
Yeah.
Slammed it.
Exactly. Wow. This has been amazing. I have more questions, but it's time.
It's time of my heart.
Exactly. Yeah. This has been amazing. Is there one thing?
I forgot about that question again.
What's one thing that right now listeners you think is the most important thing that they need to walk away with?
I think it's, if you're listening to this because you're thinking about therapy, just know that you will do it when you're ready. And it takes a tremendous amount of courage. And if your therapist says something that pisses them off, tell them.
And on that note,
yes, pisses you off. I got that wrong. I got that backward.
Pisses you off.
Your therapist also, if they get pissed off with you, if they're good at their job, they will try to find a way to talk to you about it. But that's a whole other topic.
Yeah, which I'm sure we'll eventually talk about. Hopefully.
Yes.
Alex, thank you so much.
Thank
as
you,
always,
Jackie.
Appreciate it.
Sure. Yeah.
Thank you so much for tuning in today. I've got all the links in the show notes for you, some resources that you can look up, and of course, Dr. Alexandra Guhde's details if you want to get in touch with her. If you found this episode helpful in any way and you think you know someone who would also find this helpful, please send it over to them, leave a review, and of course, subscribe to the channel, because all of that helps me to continue to talk to incredible people and bring you incredible guests, resources, and expert advice. So stay awesome, and we'll catch you next time.